If you have quietly wondered whether skipping one small test could change the course of your next 10 years, I want you to sit with me for a moment. You may feel mostly well. You may cook your meals, water your plants, remember your grandchildren's birthdays, and yet perhaps you have noticed small things. Climbing stairs feels heavier. Your balance wavers just a touch. Names take longer to come. Nothing dramatic, just whispers. You are not fragile. You are aging. And aging, my dear, simply asks for wiser attention. I'm Dr. Margaret Hale. I am 86 years old now, long retired, and for over 50 years I cared for women just like you, strong, capable women who rarely complained. I have sat across kitchen tables and exam rooms with thousands of patients over 50, and if there is one thing I gently begged them to do, it was this: do not skip the quiet tests. Not because something is wrong, but because your body, like a well-kept home, needs routine inspection. You would not wait for the roof to collapse before checking for a leak. You would not ignore a faint crack in the foundation. You would look early, calmly, and fix what is small. Your body deserves the same respect. Let me begin with the first test I urged women never to skip after 50, a simple bone density scan. Your bones are like the wooden beams inside a house. In youth, they are thick and solid. After menopause, they slowly thin, often without pain. Bone loss is silent. You do not feel it happening. You may walk for years unaware that your beams are becoming lighter. I remember Eleanor, a 72-year-old school teacher. She felt perfectly fine. She almost canceled her scan because she felt strong enough. Her test showed early bone thinning. Nothing dramatic, but enough that we adjusted her calcium intake, encouraged gentle weight-bearing exercises, and reviewed her vitamin D. 5 years later, when she slipped on wet grass, her bones held firm. That small scan likely spared her a hip fracture. You see, this test is not about fear. It is about foresight. The second test I always emphasized was blood work, simple, routine blood work. Blood sugar, cholesterol, thyroid function, vitamin levels. Your blood is like the water flowing through a garden. If it carries too much sugar, too much fat, or too little of something essential, the roots suffer quietly. Circulation changes as you age. Arteries stiffen slightly. Metabolism slows. None of this means decline is inevitable. It means maintenance matters. Many women told me, "But I feel fine." And often they did. Yet mild thyroid changes can make you feel tired and foggy. Subtle anemia can make stairs feel steeper. Elevated blood sugar can quietly strain your nerves and kidneys long before symptoms appear. Margaret, another Margaret, age 68, came in simply because her daughter insisted. Her blood sugar was creeping upward. Not diabetes yet, but close. We made gentle changes: daily walking, more fiber, fewer processed sweets. 2 years later, she remained medication-free. The test gave her time, and time is precious. Then there is the mammogram. I know it is uncomfortable. I know it is easy to postpone. But breast tissue changes with age, and early detection makes treatment far simpler and less invasive. I once cared for a woman named Rose, 74, who delayed her screening because she felt embarrassed. When she finally came, we found something very small, so small she could not feel it. It was treated early, and she returned to her garden within months. Early testing did not create fear in her life. It preserved her normal days. Colon cancer screening is another test many women quietly avoid. Whether through stool testing or colonoscopy, it can detect changes before they become dangerous. The colon is like plumbing in that well-kept home. If a small blockage forms, you clear it early. You do not wait for a flood. And then there is blood pressure. Such a simple check. So easy to ignore. High blood pressure rarely causes pain, but over time it strains the heart, the brain, the kidneys. It can affect memory and balance by altering blood flow. Checking it regularly is like checking the pressure in your home's pipes. Too high for too long causes wear. Beyond these screenings, I often recommended hearing and vision checks. Not because losing clarity is weakness, but because clear sight and sound protect independence. Poor vision increases falls. Untreated hearing loss isolates you quietly and strains your brain as it works harder to decode muffled words. Your brain, my dear, is like a beautiful library. With age, some pathways become less traveled. That is natural. But poor circulation, unmanaged blood pressure, untreated diabetes, and sensory loss can dim the lights unnecessarily. Tests help keep the lights on. I never begged my patients to chase youth. I begged them to protect function. If you are listening to me now and you value steady steps, clear mornings, and the dignity of independence, then consider these tests not as medical chores, but as gentle inspections of a beloved home. If you would like me to continue sitting with you like this, sharing what decades have quietly taught me, you are welcome to subscribe. Not for excitement, not for alarm, but for steady guidance. Think of it as having a grandmother doctor in your kitchen once a week, reminding you of small, wise steps. You are not weak for needing tests. You are wise for allowing them. And this is only the beginning of what I have learned about the quiet maintenance that protects your strength after 50. When you reach this season of life, you begin to understand something very important. What you cannot see can still shape your future. There are a few more tests I used to gently insist upon, not because I expected something to be wrong, but because I respected how beautifully complex your body is. Let us talk about your heart. An electrocardiogram, or sometimes a simple cardiac evaluation, becomes more meaningful after 50. Your heart has been beating faithfully for decades. Like a well-used pump in a garden, it may not complain even when it is working harder than it should. Women often experience heart disease differently than men. You may not feel crushing chest pain. Instead, you may notice unusual fatigue, shortness of breath when carrying groceries, mild nausea, or simply a sense that your energy is not what it once was. I remember Clara, 71, who told me, "I think I'm just getting lazy." She felt winded folding laundry. Her evaluation showed early coronary artery disease. Nothing dramatic, but enough to adjust her medications, improve her walking routine, and monitor her cholesterol more closely. Within months, she felt stronger, not younger, but steadier. Your heart deserves attention not because you are fragile, but because you have asked it to work for many years. Another test I urged women not to skip was a simple cognitive screening. Now let me say this gently. Forgetting a name or misplacing your glasses is not a disease. Your brain, like a treasured library, reorganizes itself over time. Some pathways slow, others deepen. But subtle changes in memory can sometimes signal vitamin deficiencies, thyroid imbalance, medication side effects, or circulation issues. A brief screening allows you to notice patterns early. I once cared for Helen, 76, who worried she was losing her mind. Her screening showed only mild changes, but her blood work revealed low vitamin B12. After correcting it, her thinking sharpened noticeably. Not perfect, just clearer. Sometimes what feels frightening is simply correctable. Then there is kidney function testing. Your kidneys are quiet filters. Like the drainage system beneath a house, they remove waste and maintain balance. With age, kidney efficiency can decline slowly. Many medications, even common ones, are processed through these filters. A simple blood and urine test ensures that what you take supports you rather than strains you. I often reviewed medications carefully with women over 60. What was appropriate at 45 may be excessive at 75. Dosages sometimes need gentle adjustment. It is not weakness, it is recalibration. And let us not forget vaccinations. I know this may seem separate from tests, but preventive health includes protection. Immunity changes with age. Illnesses that were once minor can become heavier burdens. Staying updated on recommended vaccines after discussion with your physician can protect your independence in ways you may not immediately see. I also encouraged women to check their balance formally. A simple balance assessment in a clinic can reveal subtle instability long before a fall occurs. Muscle mass decreases naturally with age, a process called sarcopenia. Think of your muscles as the ropes supporting a tent. Over time, if they thin, the structure sways more easily. Strength training, even light resistance bands or body weight exercises, can rebuild some of that support. But you must first recognize where you stand. Dorothy, 80, came to me after a minor stumble. She had not fallen, but she felt shaken. Her balance test showed weakness in her hip stabilizers. With gentle physical therapy and daily practice standing on one leg while holding the kitchen counter, her confidence returned. Not dramatic, just steady. These tests, bone scans, blood work, mammograms, colon screening, heart evaluation, cognitive checks, kidney function, balance assessments, they are not predictions of doom. They are conversations. They allow you to ask your body, what do you need now? After menopause, estrogen declines. This affects bone density, muscle mass, circulation, even how your brain processes information. Metabolism slows. Inflammation may increase slightly. None of this is failure. It is transition. When you water a garden differently in autumn than in spring, you are not mourning the season. You are responding wisely to it. I want you to understand something deeply. The purpose of these tests is not to chase youth. It is to preserve function, to protect your ability to rise from a chair without strain, to remember a recipe without frustration, to walk across a room with confidence. You have earned that dignity. If you have postponed a screening because you feel fine, I gently encourage you to reconsider. Not urgently, not fearfully, but thoughtfully. Schedule the appointment. Bring a list of your medications. Ask questions. Bring a daughter or friend if you wish. You are not being dramatic. You are being responsible. And if you choose to continue listening to my voice in these conversations, know that I speak to you not as a lecturer, but as a grandmother who has seen what small, consistent care can do over decades. There is still more I want to share with you about how these tests connect to daily habits, the quiet things you do at home that make the results stronger. Now let us gently tie all of this together. A test by itself does not protect you. It simply shines a small light into a room you cannot easily see. What truly protects you is what you do with that light. After decades of caring for women over 50, and now living well into my own 80s, I have learned that the goal is not perfect numbers. The goal is preserved independence. When your bone scan shows mild thinning, you respond not with panic, but with nourishment and movement. You add simple strength exercises 2 or 3 times a week. You stand up from your chair 10 times in a row. You carry light groceries instead of avoiding them. You step outside for sunlight. You give your bones a reason to stay strong. Bones are living tissue. They respond to use. Like the wooden beams of a house, they remain sturdy when gently loaded. When your blood work shows rising sugar or cholesterol, you do not scold yourself. You adjust your garden. You increase fiber, vegetables, beans, oats. You walk after meals. You drink water more consistently. You sleep a little earlier. Small daily tending prevents larger repairs later. When blood pressure creeps upward, you breathe more slowly. You reduce excess salt. You move your body with rhythm, perhaps a steady walk while listening to birds in the morning. Circulation improves not through extremes, but through consistency. Your heart, remember, is a faithful pump. It appreciates steady habits. If cognitive screening reveals mild changes, you strengthen your mind the way you would strengthen your legs. You read. You write letters by hand. You learn a new recipe. You call a friend instead of withdrawing. Conversation stimulates the brain. So does laughter. Loneliness is heavier on the brain than most people realize. Hearing tests and vision checks are not vanity. They protect connection. When you hear clearly, you participate. When you see clearly, you move confidently. These preserve dignity more than any cosmetic change ever could. I want to tell you about Ruth, 82. She came to me years ago with nothing serious. Her tests were mostly stable, but she felt she was fading. After reviewing everything, we focused not on medicine, but on routine. She began light strength exercises 3 days a week. She joined a small reading group at her library. She corrected her hearing with simple aids. Within a year, her posture improved. Her balance steadied. Her mood brightened. Nothing dramatic happened, and yet everything changed. This is what I mean when I say, do not skip the tests. They allow you to intervene gently, early, wisely. Aging changes your body in predictable ways. Muscle mass gradually decreases unless you challenge it. Bone density softens without resistance and adequate nutrition. Circulation becomes slightly less elastic. Metabolism slows. The brain processes information a bit more deliberately. None of these are signs of failure. They are invitations to adjust. Think of yourself as a well-loved home that has stood through many seasons. In youth, repairs were rare and effortless. In later years, maintenance becomes more regular, but also more thoughtful. You no longer rush. You inspect. You tend. You reinforce. And there is something beautiful about that. Please hear me clearly. These tests are not replacements for your physician's advice, nor are they guarantees of anything. They are tools, conversations, markers along the path. Always discuss what is appropriate for you personally with your healthcare provider, because your history, medications, and family background matter. But do not let embarrassment, busyness, or quiet denial keep you from wise stewardship. You are not being difficult. You are not wasting anyone's time. You are honoring the body that has carried you through childbirth, careers, caregiving, heartbreak, joy, and decades of responsibility. At 86, I can tell you this: strength in later life does not come from pretending nothing changes. It comes from responding wisely when it does. If your energy dips, investigate gently. If your balance wavers, assess it calmly. If your memory concerns you, look into it early. Most changes are manageable. Many are reversible. Almost all are easier when addressed sooner rather than later. Aging is not weakness. It is a stage that requires more attentive gardening. You are still capable of steady mornings, meaningful conversations, and independent steps across your kitchen floor. Those are worthy goals. Those are beautiful goals. And if you would like to continue these quiet conversations with me about strength, clarity, hormones, sleep, mobility, and the small habits that protect your later years, I would be honored to sit with you again. Until next time, take one small step. Schedule one appointment. Go for one walk. Drink one extra glass of water. Call one friend. Small actions, repeated gently, build strong decades. You are not fading. You are evolving. And you deserve care that is just as wise as you are. I will speak with you again soon.